Hello viewers, welcome to my channel. Today the drug we are talking about is methyl prednisolone sodium succinate. It is an steroid injection. The common brand names for this injection is solomedrol and dipomedrol. Let's talk about the dosing. In dosing we will divide it into two categories. First one is adult and second one is pediatric dose. So in adults, we will further divide into anti-inflammatory doses and in doses for severe conditions. For inflammatory conditions and for the purpose of immunosuppression, the dose that we will give to an normal adult patient is approximately 500 mg IV or IM daily for 2 to 3 days, which depends on the severity. Now let's come to the severe conditions, which are shock, anaphylaxis. In these conditions, the dose will be increased to 1 to 2 gram daily. Now let's talk about the pediatric dosing. For pediatric patients less than 12 years, the dose is 1 to 2 mg per kg per day. The normal concentration of the injection prednisolone sodium succinate is 500 mg. So keep that in mind. Let's talk about its dilution. It comes in a powder form in vial, and as I already said, the vial is mostly it is 500 mg, and we can dilute it in like 5 ml or 10 ml sodium chloride, NS or dextrose water. If the required dose for the patient is less than 250 mg, then we will dilute this drug in an injection of 5 cc or 10 cc injection, and we will give it to the patient in the form of IV bolus in 3 to 5 minutes. But if the dose required is more than 250 mg, like it's 500 mg or 1 gram, then we will dilute the injection in 50 to 100 ml sodium chloride or 5% dextrose water, and then we will start infusion, which we will give in 15 to 30 minutes. Now let's talk about the mechanism of action, how this injection is working. First of all, it is an synthetic glucocorticoid, so it's not naturally occurring, and it acts by binding to cytoplasmic receptors. There are receptors for this injection which are present in our cell, in cytoplasm of our cells, and this drug goes there and attached to that receptor. After that, that complex of receptors and ligand goes to the nucleus, and inside the nucleus it alters gene transcription. When it alters that, it results in the following actions. It decreases production of inflammatory cytokines, which are the most common inflammatory cytokines as we know are interleukin 1, 6, tumor necrosis factor alpha, and some others too. And the second is suppression of immune cells migration to the site of inflammation. So, like in our immune cells, T cells, B cells, it will stop their migration toward the site of inflammation. And the third step is reducing capillary permeability, which results in same action. Now let's talk about its clinical uses. It can be used for, as we know, the purpose of steroid. It decreases inflammation, and it's used to suppress our immune system. So it will be used in these conditions: anaphylaxis. Second is acute asthma. The point to be remembered here, it's not very helpful in chronic asthma. It's mostly used in acute asthmatic attacks and COPD exacerbation, Spinal cord injury, it's helpful in spinal cord injury too. And septic shock. Next are the conditions which are immune immuno where our immune system attacks our body. Immune related conditions which are SLE, multiple sclerosis, rheumatoid arthritis, and vasculitis. Side effects. Let's talk about its side effects. Uh, the side effects of this injection is divided into two categories: short-term side effects and long-term. The short-term side effects include hyperglycemia, hypertension, hypokalemia. So maybe we will need to monitor pot- potassium, and if it's less, we can give potassium chloride in some fluid. For that, it can cause fluid retention, mood changes, psychosis, GI upset, and for long-term side effects, these are osteoporosis, growth suppression, which is common in children, not in adult patients. It is for pediatric patients, and myopathy. Now let's talk about contraindications. We will not give in the patient where which is which has just been given a live vaccine. As we know, live vaccines contain microbes, and in normal patients where immune system is not compromised, they doesn't attack the body and doesn't cause infection. But in sick patients, especially if we are giving steroids which causes immune suppression, the infection can be very worse. It should not be given in diabetes, as we know it causes hyperglycemia. It should not be given in patient who has hypertension. It should not be given in peptic ulcers because we know that it can upset GI. It should not be given to psychiatric patient because it results in psychosis. And that's all. This was our drug for today.